For ABCD, after breast cancer diagnosis, we have a very special guest, Amanda Kong, MD, general surgeon and surgical oncologist with Froedtert and the Medical College of Wisconsin. Thank you, Dr. Kong, for joining us today. Now, we want to know, how long have you been involved with ABCD?
So I first started with them in 2009. I met Ginny Finn, who's the director, around that time because we were involved in a group called the Milwaukee Regional Cancer Care Network. And it's a group of people from all different institutions, all different hospitals, nurses, doctors, nonprofit groups. And we work to improve cancer care for the city of Milwaukee. So I met Ginny through there and got to know her over time, and she asked me to do some teaching sessions for the ABCD mentor program. And so we've remained friends over time, and I've just worked with her since then.
She's fabulous, isn't she?
She's wonderful.
Let me ask you, Dr. Kong, what attracted you to ABCD? I mean, there are a lot of support groups out there. This one, of course, we love. But what brought you to ABCD? What made you say, this is it?
Well, you know, in the office, I'm really there to educate patients about their options and their choices. And, you know, we provide really good multidisciplinary care. But there is another side to breast cancer that physicians just can't give to patients. And that's that personalized, not that we can't give personalized medicine, but there's a side that, you know, we don't talk to them about how it affects their relationships or their children and how it helps make them decisions. And so what ABCD does is it pairs people with women who have gone through it already and can talk to them about how it's affected their lives on a personal level. And so I think it's a nice complement to the medical profession in that way. So I find that it's very successful. I've promoted it with my patients. They love it. And a lot of them have gone on to become mentors themselves.
Is it a matter of, you say you deal with patients a lot, and there has to be a fine line, not to say that you have to shut off your feelings at a point, but you're a doctor. You're there to diagnose and treat and tell them what they have. ABCD comes in and does another type of thing that complements what you guys do as well.
Yeah, I think that's a good way to put it. I mean, I think in today's day and age of medicine, it's not like the doctor tells you what to do. You know, I say, here are your choices. Mm-hmm. They're both safe. They're equally good. For example, lumpectomy, radiation, mastectomy. But ultimately, I can tell you the survival is equal, but that's a personal decision because you have to wake up in your own body every morning, and I can't make that decision. And sometimes women just need to talk to another woman who's been through it. So they say, hey, I went through radiation. This is what it's like. Or I went through a mastectomy with reconstruction. That's what it's like. And I can't tell them what to do. And so that's where ABCD comes in and is really helpful.
That's why we like ABCD, too. It's not a group setting. I mean, you are talking to somebody who may have walked the exact same path that you're walking because there are so many different journeys when it comes to breast cancer.
The nice thing about ABCD, too, is actually I've done some research with Ginny. We've looked at different models of peer-to-peer mentoring. And ABCD is special in that there's a lot of literature out there that shows that peer-to-peer mentoring, if it's not done in a good setting, can actually be detrimental. But what they do at ABCD is they actually educate their mentors, which is what a lot of programs don't do. And they teach them to be in some ways, very neutral, not just spew their medical, information. And I think because Ginny has helped create a program like that, it's been really nice for patients.
In the news, we've heard, some different recommendations. What age do you recommend that a person get a mammogram?
Right, so it's been controversial. The United States Preventative Task Force came out with a recommendation starting biennial screening, meaning every other year, 50 to age 70. Since then, they've revised it on their website, and they now say, any age outside of that range, it's a personalized decision with your doctor. The American College of Surgeons, the American College of Radiology, and the American College of Obstetrics and Gynecology, we all agree starting at age 40 annually. It's not a very expensive test, and there's not a lot of risk with it. I still tell my patients yearly at age 40.